Supporters of the Affordable Care Act have a tendency to say that Republicans have no plans for comprehensive health reform. That's not quite right. They have a great many plans, and we're going to link to 1, 2, 3, 4, 5, and 6 in the description below. But they've coalesced around none. Repeal and replace, if the GOP decides to pursue it in earnest, will be incredibly challenging. At least since the 2012 election, repeal has never actually seemed within reach for Republicans. Repeal and replace was a political mantra. As recently as last Monday, Paul Ryan conceded that the expected Clinton victory would be the final death knell for repeal efforts, though the rhetoric would persist. But that was an eternity ago. We are in a different era now. The new question of interest is this: what policy changes would be minimally necessary for Republicans to claim that they've succeeded in replacing Obamacare? Health wonk and Incidental Economist editor Adrianna McIntyre asked what would be seen as sufficient to rebrand the law. Let's discuss. This is Healthcare Triage News. Special thanks to Adrianna, from whose blog post we adapted this episode. And, as she would say, none of this is intended to suggest that she or anyone at Healthcare Triage endorses these provisions. Number 1, turn the individual mandate into a continuous coverage mandate. Last Friday, President-elect Trump stated that he wants to maintain the ACA's protections for people with pre-existing conditions, which are favored by 2/3 of Americans. Of course, these protections are why the individual mandate exists, to ensure that the risk pool has an adequate number of healthy people to balance out the sick. But it seems politically untenable for Republicans to leave the individual mandate intact after making it the central constitutional challenge to the law. The American Enterprise Institute advanced the idea of a continuous coverage mandate in their white paper, making guaranteed issue and community rating contingent upon people carrying insurance without any lapses in coverage. This, of course, is problematic for many people with chronic conditions and volatile incomes. Redesigning the mandate would require legislation, though repealing the mandate could be done through reconciliation. 2, block grant Medicaid, but otherwise preserve the expansion. Though it doesn't purport to keep expansion in place at current funding levels, a central feature of Speaker Paul Ryan's Better Way plan is to turn Medicaid into a block grant, where funding would be restructured using per capita, not global spending caps. Unwinding Medicaid expansion would put governors in many red states in a bind and would be out of step with Trump's populist message. Trump has condemned the individual market, but hasn't really attacked Medicaid. Adrianna's bet is that Republicans don't want to claw back coverage, but to rebrand the program, they'll insist on restructuring its financing. The CBPP has estimated that block grants proposed by Paul Ryan in the past would dramatically inflate the number of under and uninsured. This would also require legislation. If you want my opinion, I think that this is one Republicans will fight for. Number 3, narrow essential health benefits. The law enumerates 10 categories of essential health benefits that insurers are required to cover. However, these categories are broad, like hospitalization and prescription drugs, and the Secretary is given responsibility for more explicitly defining those essential health benefits. The Obama administration punted this obligation to the states, but a Trump administration could plausibly redefine each category much more narrowly through the regulatory process, with or without congressional support. This could include, as Sarah Cliff has noted, withdrawing copay-free coverage for birth control. They could just do that. 4, reduce the minimum actuarial value permitted on the individual market. Right now, bronze plans offer an actuarial value of 60%. Watch our episode on health insurance to understand that. Enrollees can, on average, expect that the plan will cover 60% of their medical expenses. For reference, employer plans tend to have actuarial values north of 80%. However, if you lowered actuarial values, you would commensurately lower premiums, and Republicans would likely label these plans catastrophic insurance, though many folks consider the current bronze level to be near catastrophic. Avik Roy proposed in his plan reworking the middle tiers in the ACA to have actuarial values of 40, 55, 70, and 85% for bronze, silver, gold, and platinum plans, respectively. Expect anything like this to be paired with policies around HSAs. Actuarial value levels are written into the statute, so this would require legislation. Number 5, loosen the age band. Right now, the way plans are structured, the most expensive plan for older people in any exchange can only be 3 times the cost of the cheapest plan, which is mostly pitched at the young. Therefore, the age band is considered to be 3-to-1. The Burr-Hatch-Upton plan would establish a 5-to-1 band. Roy's plan would make it an even wider 6-to-1. Based on an analysis by the Urban Institute, this is unlikely to change premiums much for people in the middle half of the age range, but could make coverage considerably cheaper for young adults and commensurately more expensive for the near elderly. This would be the least controversial of the reforms I've discussed, but would still need to be legislated. And more. There are 3 other things worth keeping an eye on: the Cadillac tax, the Independent Payment Advisory Board, and the Center for Medicare, Medicaid's Innovation Institute, and all that stuff. The Cadillac tax was already delayed for 2 years, and given that economists are its only cheerleaders, it seems likely that the Congress will either keep delaying it or outright repeal it. It seems likely that IPAB, the so-called death panel, is on the chopping block too. Adrianna is less convinced that Republicans will maintain their eagerness to repeal CMMI under a Republican president, but any aggressive action using CMMI would have to contend with the party's reaction to the Medicare Part B proposal in general. I personally think CMMI could be in trouble. Everything requiring legislation will be a battle, as long as the filibuster remains intact. However, Republicans could use reconciliation to sunset key parts of the ACA, imperiling the stability of the individual market, and use that to pressure legislators into passing replacement provisions. It'd be a risky and ugly game of chicken, with lies literally hanging in the balance. I think this could actually happen. I think that it'll be accompanied by every 6-month to a year battles like we had with the doc fix, but kicking the can down the road is a specialty of Congress. But this is 2016, so I have no idea what's going on. Anything is possible.
Healthcare Triage is supported in part by viewers like you through Patreon.com, a voluntary subscription service that allows you to support the show through your monthly donation. We'd like to thank our research associates Joe Sevitz and Karen Green, and our Surgeon Admiral, Sam. Thanks, Joe and Karen. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.